My name is Dr. Curtis Stinnes. I'm an interventional cardiologist. So I currently practice at the Scripps Clinic Torrey Pines facility and also at the Scripps Prebys Cardiovascular Institute. I became an interventional cardiologist because I've always been very fascinated by the heart and the cardiovascular system. You know, our heart beats over 100,000 times a day, and we take that for granted when we're healthy. But unfortunately, heart disease is still the #1 killer of all men and all women in the US. And so I wanted to impact a large number of people, and so this is a simple way to do that. Also, I've been very fascinated by the techniques and technologies that have been developed to effectively treat heart disease. And so that drew me to this specialty. I focus on the treatment of atherosclerosis in general. And when atherosclerosis forms in the coronary arteries, we call it coronary artery disease. This is basically fatty deposits that block blood flow to the heart. When these deposits build up in the legs, we call it peripheral arterial disease. But really it's important to realize it's essentially a spectrum of the same disease. And so many of the procedures I perform involve clearing out those blockages with minimally invasive methods such as balloons, stents, and catheters. In addition, I also focus on treatment of diseased heart valves with catheter-based heart technologies such as TAVR, or known as TAVR procedures, whereby a patient with a diseased or narrowed aortic valve can undergo a valve replacement with just a very, very tiny incision and a catheter-based technology. Many patients at other places or have been treated by other physicians have been told you need open heart surgery to treat your condition, or you need a major surgical bypass of your extremity. What we do here that's quite different is look at those patients from the perspective of, is there a less invasive way of treating this condition? Is there an effective strategy that doesn't require a big risky operation? And in many cases the answer is yes. And so we offer many of these treatments, many of which have been basically pioneered here at Scripps over the years. We use these techniques and technologies to effectively treat these patients that can't be treated at other institutions. What I think patients can expect when they come to see me is to know that I will treat them as a unique individual. And I really believe strongly in the notion that patients need to be educated about their condition. The whole, 1950s mentality of take 2 aspirin and call me in the morning, it just doesn't cut it. And I really take the time to sit down with patients, explain to them what their disease situation is or what their problem is, and explain all the potential options for treatment and what those would entail. And I think that leads to the empowerment of the patient to understand what's wrong with them, and then they can be more proactive about their care in the future. And that helps them better take care of themselves as well. The most rewarding part of my job clearly is the positive impact on patients' lives. To see patients that have, say, had a heart attack, and you can stop that heart attack in its tracks and they can go home in a few days and be with their family and live a normal life is extremely rewarding. When patients have a limb that's severely threatened, that's been hurting them or being threatened with amputation, and you can rescue that limb and give them that part of their life back and see them be active again is extremely rewarding. When you can take a patient who has a severely narrowed heart valve that's been told that surgery just isn't a good option for them because they're too sick or too old, and being able to treat that patient with a less invasive technique or technology and see them come back and say they felt the best they felt in the last 30 years, extremely rewarding.